Season 9 of Aging and Awesome. Diabetes comes with a lot of complications, and complications with your sight is a prominent one, which is why Dr. Dave Freeman of the Reno Eye Institute is here to shed light on what we need to watch out for and how to prevent as many problems as possible. Dr. Freeman, welcome back to Aging and Awesome.
Thanks for having me, Kai.
So diabetes is the #1 cause of preventable blindness, correct?
It's the #1 cause of preventable blindness in the Western world. And by that I mean, the Americas, Central America certainly.
And so what are some of those symptoms?
You might notice blurred vision. Sometimes your night vision can become compromised. Sometimes you can see things floating around inside of your eye. So like I say, it's important to get exams because a lot of times it's not detectable by the patient.
So it's not just, oh, my eyesight's getting bad. It's no, I need to see a professional when those symptoms come up.
Correct, because diabetes can lead to many more things inside of the eye and in the body as well. Namely, in the eye, it can lead to cataracts, it could lead to glaucoma, it could lead to dry eye syndrome. Lots of different things that affect the eye are linked to diabetes inside of the eye. So if one were to have those symptoms that I just mentioned, it's worth getting looked at for sure. Diabetes can affect many different organ systems inside of the body, from the brain to the heart to the feet, and more importantly to this talk, inside of the eye. The CDC says that 60% of patients do not seek eye care within the first 5 years of getting diabetes. So these are all really important things, and one of the things that primary care physicians and people who take care of diabetes primarily always emphasize to their patients, you gotta get an eye exam at least once a year usually.
Well, we have a full house here at the Virgil with our live studio audience. Do we have any questions for Dr. Freeman?
If you're pre-diabetic, can your eyes be affected, or does it have to be more advanced?
Well, thank you for that question, Kat. Usually with diabetes, it takes a while for things to set in, at least inside of the eyes itself. It's more of a disease of prolonged high blood sugar for a prolonged period of time. So if you've been coined having pre-diabetes, it doesn't mean you still shouldn't get an eye exam, because a lot of times when the doctor says, oh, you have pre-diabetes, sometimes the blood sugar may be higher than we'd like it, especially if you get just an annual exam with your primary care. So I say it still can affect your eyes, but usually at that point, if the high blood sugar is affecting your eyes and you start developing complications from diabetes in the eye, usually it's more full-blown diabetes and not pre-diabetes any longer.
Can you speak to the relationship between steroid usage and diabetes or high glucose levels?
Certainly steroids can cause havoc in lots of different parts of the body, especially the eyes. The two things we worry about in the eyes usually with steroid use are cataracts and glaucoma, which is part of a separate talk. However, if you use steroids, any type of steroid, by the way, whether it be through the nose or pills or through an intravenous solution, it can cause high blood sugar. So anytime we have patients that are treated with steroids for other systemic diseases, we certainly monitor them to make sure that there's no havoc going on inside the eye.
Thank you so much, everybody. Great questions. Dr. Dave Freeman with the Reno Eye Institute. If you'd like to reach him, you can so by calling the number on your screen. Dr. Dave Freeman, thank you.